The Associated Press says that 6.4 million signed on to Obamacare, and that's down from their goal of 13.8 million. Now let's talk about this just for a minute. Even though President Trump is working with the Congress to do away with Obamacare, people that have signed up this year are still going to have their insurance. So we'll be covering this all year on the news show, and we'll be covering the transition as well. So, for example, President Trump and the Congress, Speaker of the House Ryan, and Senate Leader Mitch McConnell have assured us that we are still going to have chronic illnesses covered, pre-existing conditions. We're still going to have people up to 26 years old still on their parents' insurance. We're still going to have many of the things and probably have some of the caps on how much the out of spending is. So there'll be a lot of things in your insurance. The real question is, will we have subsidies or not? Remember, this was all part of the public system where taxpayers put money into subsidizing people's insurance, especially people that couldn't afford the premiums. So we don't know where that's going to work out. It looks like what's going to happen is, since President Obama was never able to get the public option, which would have the government compete with insurance companies in order to get premiums down, so as a result, premiums for the rest of the country all went up. What's going to probably happen is President Trump and the Republicans want to have competition across state lines to try to get the premiums down, but we're not going to have our taxes being put in to subsidies and things. So we're going to have to see the economics, but we'll still be dealing with Obamacare this year. We'll have to see how the economics works. Congress is going to take time to put in their replacement plans, but I really think you should carefully look at the Southern congressmen, their doctors, who've worked together to put together a plan similar to last year's plan. Senator McConnell said it's very similar to the 2015 proposal. It seemed all-inclusive. The only difference that I can see is they're going to go back to, remember, before Obamacare, we had high-risk insurance pools for very sick patients. I think we're going to go back to some kind of high-risk pool because, look, you've got to pay for these sicker patients. Everybody is going to be signed up just like Obamacare, whether you're sick or not, but you're going to have a way to pay for these. So they're going to have some kind of high-risk pool since we're not going to have government subsidies paying the insurance companies for this care. And Trump feels as though he can also get the price of medicine down. We'll have to see if he can do it through competition. So this is going to be a very intensive year, and I look forward to every month keeping you up on that, and we'll learn from it together. And, you can feedback your comments and questions, and we'll see if we can do this together. Okay, let's continue with the insurance updates. CNN said that Trump was meeting with leaders in healthcare from the Mayo Clinic, Cleveland Clinic, Johns Hopkins Hospital, and Harvard. And so he's getting together with leaders that have done successful plans. But again, remember, as I just said, the Republicans, especially these congressmen down south, have put together a very good plan that's comprehensive, similar to the one they proposed in 2015. So I'm sure the Mayo Clinic and Cleveland Clinic are probably looking at that as well. Let's see. The New York Times says that almost 1/3 of the employers are choosing high deductible plans this year to lower premium costs. And let's talk a minute about that. This is one of the biggest catapults that Congress did to repeal Obamacare because 95% of the country saw rises in their premiums. And in addition to rises in premiums, you have high deductibles, $7,000, $8,000, essentially means that you have no insurance. Unless you're hospitalized, God forbid, with a $30,000 bill and your $7,000 deductible, you still have to pay that first, it kicks in. So basically, and yet, in order to get the premium prices down, because we don't have really the competition now with companies dropping out of the exchanges and all of that. Therefore, employers are buying high deductible plans to get the premiums down. Essentially, you don't have insurance. which is what we said the last news show, that Obamacare wasn't working anymore. And so let's see what happens. But obviously, buying high deductible plans, even with a low premium, what's the good of that? You don't even have insurance. Okay, let's see. The Washington Post said that Wonk Blog reports, W-O-N-K blog, it's a blog, a breakdown of the 2013 healthcare spending data. And as you might expect, the highest amounts of money spent were on diabetes, heart disease, back and neck pain, and that 1/3 of the total cost was spent on elderly care. I don't think there's any surprises there. Now, this is interesting. The Washington Post also says that the cost of insulin, and this has really been a big debate in Congress if you've been watching any of those C-SPAN programs, the cost of insulin has gone up from $17 a vial back in 1997 to, get a load of this, $138 a vial today. And there is no generic insulin. And I don't even know if that would matter if there was generic insulin, because even generic prices have really gone up. And that's one thing that the leader of the Democratic Party, Senator Schumer, he's been, along with others, Frank Pallone here in Jersey and others, have been really attacking the generic companies for tremendously increasing their prices. Yeah, I mean, this is definitely a big problem. We have to find a way to have cheaper drugs, and I think this is something that President Trump's working on. New York Times just wanted to remind us that the 21st Century Care Act, if you remember, that was an act that was passed that Obama signed. It went through very late last year, and that's a huge comprehensive plan to fund the cancer research that, remember, Joe Biden's doing, our former vice president, work on opioid addiction that our Governor Christie has backed that here in Jersey. A lot of money going out into these things, public health funding, et cetera. And now one of the big fears is, even though we have the 21st Century Act, because Obamacare is being repealed, we have to be sure that some of that doesn't take away from our public funding, which is already bare bones in New Jersey. And these wonderful work our State Department and the workers do, they're really working on decreased funding. So we have the 21st Century Act, which should bring money into cancer, National Institute of Health sponsored research, all that stuff, opioid stuff. But we just have to be careful that we don't take away other public funding. NPR is talking about Speaker Ryan. This is interesting, and I'm not really sure where this is going to go. We'll have to follow it. You know, the Congress is trying to do something with the huge cost that Medicare has, and people are afraid they're going to endanger Medicare if they privatize it. But what Speaker Ryan said is he wants to set up Medicare exchanges, moving all the seniors like into Medicare Advantage. I'm not sure that counts as a real privatization of Medicare. A lot of people on Medicare now use Medicare Advantage because straight Medicare doesn't pay for everything. So I'm not really sure why that's necessarily a bad thing, but everyone is afraid to see what Speaker Ryan's going to do with Medicare. But let's take a closer look at it. But if it's just putting everybody on Medicare Advantage, that may not be such a bad thing. Representative Tom Price, as you know, is trying to be sworn in as our next Human Health Service. He was one of those Southern doctors we talked about that wanted to appeal Obamacare and help write the new Republican comprehensive health care strategy. He's an orthopedic surgeon. He knows what it's like for us as physicians to try to treat patients and get the care they need and get it paid for. And so I think he'll do a good job. He's having a tough time with confirmation hearings now, so we'll have to follow that. But he seems like a very good person, well-versed in this. He was actually the chair of the House Budget Committee. So, I mean, Trump's being really smart. He's positioning people that have a lot of experience and They seem to know the area they're in. They know business. In this case, Dr. Price is an orthopedist and a well experienced congressman who chairs the budget committee. So certainly he would know how to run human health service. So let's see if he gets elected, but we'll follow that for you this year. Star Ledger says that Sloan Kettering Cancer Hospital has merged with Hackensack Meridian, and that's a very good thing. We've had Sloan in here in certain places, in Denville, for example, and I think a couple other places. But now to have Sloan actually attached to a big hospital system in Jersey. Remember, Hackensack Meridian is the second largest hospital system in New Jersey. It recently merged. It's second to the Rutgers-Barnabas system. So to have them officially merged with a major New York cancer hospital like Sloan Kettering is a good thing. It'll get us research money. We'll get care a little faster. As a side note, Barry Prystowsky, the CEO for Rutgers-Barnabas, just put out a note to those of us in the Rutgers system that he has a deal with Children's, with University Hospital and Children's Hospital in Philly, which is wonderful, the same sort of thing. So attaching to major educational institutions would bring us up to the level similar to like being attached to a Cleveland Clinic or Mayo Clinic. So I think these are really good moves. Hackensack Meridian with Sloan Kettering, Rutgers-Barnabas down with the Philadelphia teaching hospitals. I think it's a really great move. The Ledger says, as you know, there was a law in 2014 that adoptees had a right to know who their biological parents were and what the medical history was on them. That finally came through as of this month. So letters went out to all the people who were adopted, telling them that they had the right now to find who their parents were and what the medical history was, unless the parents had signed saying they don't want it. I think the Ledger said very few people signed. So we'll have to see if that was fruitful for these people who were adopted. We'll follow that in the Ledger with you. CNN reports from the Trust for America's Health. Trust for America's Health. This is a scary thought. We're still not ready for epidemics. If you remember think back to 2009 when H1N1 came up from Mexico, and we thought we were going to have a huge flu like the 1919 bird flu that would devastate this country. It killed a lot of people in Mexico, but it didn't kill many people here in America. That H1N1 shot since 2009 has been a part of our flu shot. It's now 4 strains rather than 3 in our flu shot. Anyway, the government had come out at that time and had said to us, pretty much you're on your own localities. Don't expect us as the government to come out and run all your hospitals and things if the country shuts down with a massive flu epidemic and everybody's sick and nobody can work and it's a mess. So whether you're talking about, I think in terms of terrorist attacks, we're all pretty comfortable that we're doing as much as we can. But in terms of, biological illness, our system is going to be overwhelmed. And I think that that's what this report shows. How are we going to get labs? How are we going to have doctors to be able to see patients in their office if things are quarantined? Like remember with the Ebola patients, you had to have a special team pick them up to transfer them to a regional hospital that was set up just for Ebola. Those hospitals have been set up. If we get a major contagion like that, will we have enough respirators? How will we decide who lives on a respirator and who is not going to be given a respirator to live? This is what they're talking about. I don't think they're talking as much about blowing up chemical plants or terrorist invasions. I think they're talking about how to handle massive disease. That's always been a problem because we are very territorial. We don't have huge central hospitals that work for entire states. We are very territorial, although this study was done all across the country, but it's specifically, I think, what makes sense in New Jersey. we're not very organized and everything. Even though we have huge hospital systems that are beginning to organize us, we're still our own little entities. Now, we train very hard to prepare for these. I myself have been in the Medical Reserve Corps, and we're going to put something up on the TV screen later so you can see how to join up for these things. We certainly need your involvement. But we train very well. The hospitals train us, and we certainly are prepared for these things. But it's the sheer numbers of being massively involved with having enough supplies and enough medicine and all of this. We can always do more to prepare. And I think that's being able to get laboratory reports back in time, having the staff to run these labs, having enough space to run all these labs, all this sort of stuff, I think we can always improve on. USA Today said that, I had mentioned this before, may take away money from the congressional money allotted for the state public health funding. I believe I already talked about that.
Hi, I'm Ingrid Burke.
And I'm Gina Unger.
Gina has known Dr. Berry in a professional and personal capacity for many years, and we are thrilled to be in his building. We are psychotherapists, and we offer mental health counseling for ages 12 and up. We do individual, couples, and family counseling. We're also excited to say that we have groups that we have for teenage boys and girls, for social skills, anger management, and self-esteem building. If you need to reach us,
check us out at lifeworksnj.com.
Our phone numbers are also listed on that website if you'd like to contact us. Thank you.
Thank you.
The Washington Post says that there are 5 types of birth defects with the Zika virus, which you remember is a virus that, similar to rubella, can cause birth defects in newborn babies, but it's spread by mosquitoes, like the same mosquito that spreads dengue fever. So they're just listing the kind of birth defects you have. Microcephaly, the small heads, we all know that, but you can get eye defects, defects in joints and muscles as well. And the Zika virus, if you remember last month, was transmitted in Texas from person to person, and was transmitted by mosquitoes in Texas too. I believe that epidemic cleared up, as did the one down in Miami. Now, Seattle Times, and this is very scary, says that a polio-like virus is still being reported across the country in very small numbers. I had experience with that a couple years ago. We believe it's probably one of the enteroviruses, the summer flus, because polio is part of the enterovirus family, a diarrhea virus that can cause paralysis. We've been lucky all these years that all these summer flus cause diarrhea but not paralysis, but for some reason the virus mutated, and we think it's small numbers, so don't be alarmed, but we need to watch out for weakening of limbs, especially in summertime when the children have diarrhea. Wall Street Journal said that there's another mumps outbreak. Again, college campuses, that's the usual, so we just have to make sure the vaccine's working. Our own Department of Health says that the bird flu, the scary bird flu, which would be devastating, like the one we had in 1919, killed millions of people. That bird flu, H7N2, is the one reported. That's the name of it, H7N2. It's been now reported in cats in a Manhattan animal shelter, but no transmission to humans. Remember before we would study the migration of the birds? Birds migrate in certain patterns across the world, like we have one from northern hemisphere in the Americas to the south, and we have migrations that go across the ocean. And we watch these birds to see if they're bringing bird flu and then infecting our local populations on their migratory range in this country. And of course, over in Asia, they're always slaughtering millions of chickens with bird flu, but there's never been any transmission to humans. So now that it's being transmitted to a cat, it's a little worrisome. The pig is the most worrisome. If it gets to the pig and gets to us, then we're really in trouble because the pig has a system very similar to ours. The cat, I don't believe cat illnesses, except for a few viruses like cat scratch fever, bacterial or viruses, the cats don't give us too much. So I think we'll have to watch this. They don't seem to be too alarmed about it, but they did find the bird flu in cats in a Manhattan shelter. CNN reported that Sabra Company, I think we had problems with this last year. We mentioned it. The Sabra Company recalled a humus product. It was contaminated with the bacteria Listeria, certain kind of infection, food poisoning, dysentery. These products were manufactured before November 8th. So if you've had Sabra products after November 8th, they're probably okay. Before that, you should probably look at it. I know we're a couple months past that now. USA Today says that the CDC has found a very strong drug-resistant fungus leading to 4 deaths. Resistance is a big problem. It's very scary. We need to invest in, research and development, R&D, and find new drugs and new ways of treating. I'll mention later we have a bacteria that's resistant, in this case a fungus that's resistant. And, especially the immunosuppressed are very susceptible. Their immune systems are down. They can catch fungal infections. Usually they have lines in them in the hospital, like lines in their blood or in their bladder or elsewhere. And those can get infected with fungus. If you remember, we had the problem a few years back in pharmaceutical companies mixing up products that were injected into the spinal cord, giving a very bad fungal infection. And that led to huge investigations by the government to make sure that we have safe practices in pharmacies that mix these drugs so they don't get infected like that. So this is a real problem, a fungus that's resistant to all our treatments. This is interesting. CNN reports, this is a phenomenon that I had never heard of before. It's called thunderstorms in Australia causing asthma, thunderstorm asthma, where the thunderstorms actually in these huge winds break up the pollens into such small pieces that even people that don't have asthma are now suffocating and choking and dying in some cases on breathing these in. I'd never heard of that before, but that's pretty scary stuff. Associated Press says we have a new HIV vaccine now in trials in Africa. Let's keep our fingers crossed on that. Star Ledger said we have a new Ebola vaccine that's now in clinical trials. Wall Street Journal said that, the Mylan Company has finally released a generic version of their EpiPen. You know, EpiPen's you inject yourself for severe allergic reactions. It's epinephrine or adrenaline. Mylan Company had for some reason had increased its price from $100 to $600 or $700 for 2 pens, 2 injectors. But now they're offering a generic. After a lot of congressional hearings and a lot of pressure this year, they're offering a generic version, I think, for $100 for the 2. Now, your insurance may pay anyway. I'm sorry, I believe Mylan Company is offering the generic for $300, half the price, but there is a competing company that has a generic for epinephrine for only $100. And I know about it because I've been getting letters in the mail from insurance companies. Please don't use Mylan, use the generic version. So I'll let the insurance companies deal with that. But just so that you know, your insurance may have paid for it anyway. But for those of you that have life-threatening allergies like nuts, things like that, where you can die if you eat a nut, you need to inject yourself with EpiPen immediately. It's pretty scary to not be able to afford it. And I've had patients this year that held off buying EpiPen because Mylan's prices were so high. It's horrible to think of, just a terrible thing the company did. But I'm glad with congressional input. Again, the company may not have been at fault. Maybe they had to charge this much. They gave reasons in Congress why they had to. And I'm sorry, I didn't mean to put it on the company, but it's just scary if you don't have life-saving medicine. But so there is Mylan has half the price, $300, and there is a generic version of another company, I forget who, for $100, and so you may want to look into that. The Washington Post says that LASIK surgery, LASIK, for correcting vision may have side effects, including dry eyes and glares. It's a big thing to get your eyes corrected with a laser, but just ask your doctor about side effects. Wall Street Journal says, this is very interesting, there are genetically modified pigs that are now being used for organ transplants. Who would have thought? So, we've had a big problem in this country with finding enough organs for people, for kidneys, hearts, for things people need. So the fact that now genetically you can grow and modify a pig's organ or another animal's organ to fit what is needed for that human is really exciting, so that we won't have people dying while they're waiting for an organ transplant. The Star Ledger says that out of 70% of Americans who drink, and this is probably up on your screen, 1/3 get into trouble. Wow. That seems like a high number, but the Ledger quoted this. And in terms of binge drinking, they consider binge drinking 4 drinks. They define it 4 drinks for a woman and 5 drinks for a man. But wow, seems like a high number. That's pretty scary. All right. Finally, let's move on to the last 3 healthcare tips on general healthcare news, and that's from CNN. The enterovirus, remember we mentioned the enterovirus, that polio-like virus that fortunately usually doesn't cause polio, but we've noticed this for years. There's been an associated increase in new diabetes, especially in children, during these summer flu epidemics. And we always assumed that the virus had something to do with it. We can never prove it. Now they think the virus causes a chronic infection in the pancreas, and the body then makes antibodies trying to kill the virus, ends up killing the pancreas and causing diabetes. We've always thought that, but now they're beginning to prove it. CNN says that and this is very scary, the Japanese tapeworm, they think it's not only in Japanese salmon, but it somehow got into Alaska salmon, but that's uncooked salmon or raw salmon. If it's cooked or frozen, they think you're probably okay. I eat a lot of salmon, so I hope so. But I certainly don't want to get worms. But it's something to think about if you're eating raw salmon. It's not just in Japan anymore. This worm is now here. Lastly, for general healthcare news, Vox, the Vox Media Network, has reported another super-resistant bug. Remember I was mentioning these bugs that don't respond, bacteria that don't respond to any antibiotics, and this particular one was Klebsiella, one of the bugs from your bacteria inside your gut, and it killed a woman in Nevada, but they think the woman contracted it initially in a hospital in India and then brought it here. All right, let's move on to health and safety tips. The Star Ledger says that e-cigarette batteries have exploded, burning people. In other words, they showed pictures, people had huge burns on their arms, their thighs. The e-cigarette they were smoking, the battery exploded. I remember, didn't last year we had batteries exploding in phones, and I've reported in the past that those things kids ride, what do you call them, hoverboards, those batteries exploded and burned down things. Well, it looks like e-cigarette batteries are exploding. I don't know where we're going with that. In children's health, this is pretty scary. Baby teethers for teething pain may contain a banned substance called BPA, bisphenols, that are used in making plastics. They may also contain parabens, and the banned antiseptic that was recently banned in soaps called triclosan and trichlocarbon. They were recently banned in antiseptics and soaps we use. So these banned antiseptics, banned parabens, banned bisphenols were all found in your baby's teething rings or things you put on their teeth for teething pain. Wow. CNN also reported that homeopathic ear pain drops were recalled because they contain belladonna. Belladonna is something I give my patients for diarrhea. It's an antispasmodic that shuts down the gut. It's an old medicine used for hundreds of years for many different reasons, but you probably don't want it in ear pain drops, and that's why they banned these drops. The New York Times says that there's an increase in opioid overdoses in emergency rooms in children due to the children getting the parents' opioid medicines. The Hill says that the AMA, that's the American Medical Association, get a load of this, wants to ban the use of coal tar in pavements on like playgrounds, because these sealants, these coal tar sealants, contain PAH, polycyclic aromatic hydrocarbons, that can cause cancer. Wow. CNN says that, those peanut patches they're putting on children now, they say that may decrease the likelihood they'll react to peanuts. We'll have to see what happens there. CNN also said, and I'll conclude with this. This is really interesting. Manal Elfakhani, I hope I'm pronouncing the name right, had an article called The Conversation, and he listed ways to increase the antioxidants we eat. I thought I'd end with something fun like that. And that was kind of fun. Basically, things you already know. Eat your vegetables. They have your lycopenes in tomatoes, your beta-carotenes in all your yellow fruits and vegetables, and your green leafy vegetables, your luteins. So we're talking broccoli, alfalfa, Brussels sprouts, carrots, collard greens, corn, mango, tomatoes. Eat a lot of berries, are always good for you. Fruits, nuts, sweet potatoes, they have vitamin E. Your flavonoids, which again are like your carotenoids, your flavonoids, these yellow pigments are very good for antioxidants. Found in onions, eggplant, lettuce, turnip greens, endives, pears, red wine, parsley, citrus, berries, etc., soy milk, cheese. And lastly, need your prunes and plums, probably to wash down all those other foods. Raisins, figs, cranberries, red peppers. Like they make all these fancy smoothies now, I see, with beets and kale, spinach. Of course, everyone loves ginger, rosemary, turmeric, some of your favorite stuff, and even dark chocolate. So with that, enjoy the rest of your day. I look forward to seeing you next month. And please, especially with the transition to Obamacare being repealed, please feel free to call in and give us your comments. Take care and enjoy.